my name is Luba, and today I'm going to be doing NG testing, and I'm going to be testing for the placement of the tube. This is very important, so I'm going to wash my hands, I'm going to put on my gloves. So we always want to make sure that the placement of the tube is in the right area, because if we're going to be feeding, we don't want it to get into the lungs and cause aspiration. And there are different protocols and different ways to do it in every hospital, and I'm going to show you the way that we test using the USF protocol. So we want to make sure that our patient is at least 30 degrees. We want to make sure we have our gloves. So what we want to do first is we want to inject 5 to 10 cc's of air. And listen for the bubbling sound. Okay. Another way that we can check for nasogastric placement is we would, first of all, we would be taking the residual, and we want to make sure that basically after we fed them that it's been absorbed. So we want to check for the residual, and if there's at least a fourth of the meal still in there that we can take out, this isn't very good, so we have to come back in 30 to 60 minutes and then check again. So another way, what we can do is we can aspirate. And what we would do is we would take this fluid, gastric fluid, and we would put it in a cup, and say we would put it in the cup, and then we would take the pH stick, and we would dip it in there to get the fluid, and then we would know the pH. It's important to note because the stomach is a lot more acidic, so it would have a pH of about 4. Whereas the lungs would have a much more alkaline and a pH of about, 6. So if we got on here, if we got this color of 6, then we would know that we are in the lungs, and we would know that the NGT is not placed properly. If we got about 4, so it would be orange, we would know the placement was correct. But the only sure way to ever check for a nasogastric tube is to get an X-ray. That is the only way that we will know for sure, because within the NGT tube there's a guide wire. It's metal, and you're able to see this on X-ray. So what we want to do for our patient, after we have checked for placement, what we want to do is we want to fill up our bag for at least 4 hours. And we would fill this up with formula or whatever kind of diet. There's different types of bags. There's renal diet bags, there's diabetic diet bags, and we would fill it up for however much the doctor ordered. And we would use a special kangaroo pump. The doctor would give us a rate and the volume that we're going to infuse, and we would put this in here. And then we would hook this up, and we would administer it, and it would go down. And of course, what's very important isn't necessarily that this is going down, but we want to be observing our patient. We want to be observing, are they having difficulty breathing? Are they turning blue? Are they just things that would clue you in that they're having respiratory distress? That maybe the nasogastric tube is in the wrong area. And once we've been observing our patient and it seems that they are okay, things are good, we could leave them, come back, and then we keep coming in, rechecking on them to make sure that things are good. And then we would document what we did. we would document the placement of the tube, and we would document how much we administered. Thank you.